As the coronavirus continues to spread worldwide, there's a lot of misinformation surrounding the epidemic. Is there a treatment, and how can you prevent it? What about a vaccine? CBSN New York's Dr. Max Gomez is here with some of the answers to these questions. Dr. Max.
Well, we're going to give it a shot, right?
Yeah.
So coronaviruses are actually very, very common. They can cause a wide variety of respiratory illnesses, ranging from the pretty harmless common cold to the highly dangerous Middle Eastern Respiratory Syndrome, or MERS. This new strain of coronavirus falls somewhere in between. The coronavirus is called that because of the many crown-like protrusions on its surface. And like other coronaviruses, this is a respiratory virus that causes pneumonia, the main way that it kills. It is contagious by breathing in infected droplets from coughs or sneezes, although hand-to-hand transmission is probably more significant. It's also a fairly hardy virus. A German report says it can survive on surfaces for as long as 9 days, which partly explains why it seems to be spreading so rapidly.
We have countries that are starting to have community spread, which is essentially getting us closer and closer to what you would consider the definition of a pandemic.
Those numbers are becoming concerning. Although in the U.S. there have only been 58 reported cases, globally there have been more than 81,000 cases and climbing, with at least 2,700 deaths, the vast majority in China. But today at the World Health Organization, the director said there is a glimmer of good news.
For the last 2 days, there have been fewer reported new infections in China, but the numbers could go up again.
Another glimmer of hope came from Gilead Pharmaceuticals, saying that the University of Nebraska has begun testing its antiviral drug remdesivir against the coronavirus. And Boston biotech company Moderna reported that it has shipped vials of a potential corona vaccine to the NIH to begin phase 1 human testing, although experts there say it could be a year or more before a vaccine is ready for use. And as with all respiratory viruses, including the flu virus, the best way to prevent getting infected is hand washing early and often with soap and water for at least 20 seconds. No soap and water, an alcohol-based hand sanitizer also does the trick.
20 seconds, it sounds like, happy birthday, 3 times, sing the song, something like that. That seems like a lot, but I guess that's what it takes.
It is a lot. I mean, that's how you get really, but even some hand washing, any will prevent.
Or the alcohol-based, the Purell, those type of products.
That'll help.
You mentioned in the piece it would take a year to get a vaccine together. Why does it take so long?
Well, it's about testing it is what it'll take. Now, the vaccine has been manufactured. This particular vaccine was manufactured in something like 6 weeks, which is really record time. But you have to test it first for safety, so they're going to give it to a bunch of healthy volunteers, make sure nothing bad happens there. But then you've got to make sure that it's effective, right? And so I can't give you the vaccine and then come along and try to give you the coronavirus to see if you're immune, right? That's unethical.
Not a good idea.
And nobody's going to sign up for that either, right? So that's why it's going to take a long time. You have to test it in a lot of different people, or in a large population, and compare that vaccinated population to an unvaccinated population and see whether this is actually less than the unvaccinated population.
Now, everybody sitting at home is saying, how do I keep this from happening to me? And we see a lot of people wearing the masks. What's the deal with the masks? Do they work?
No. Well, maybe 1% better here. If you're wearing a mask, that's going to keep you from infecting me.
Oh, so if I'm sick, wear the mask because I won't transmit it.
Coughing, sneezing, it all gets caught in the mask there. If I'm wearing it and you're sick, and you cough or sneeze towards me, those particles are still going to get into I've got to breathe in somehow, and it's not like an R95 canister, gas mask that really does prevent everything from getting in. So it's unlikely that it's going to have much of an effect or much benefit. Also, since the main way that it really gets transmitted is hand-to-hand contact, this doesn't do anything. The hand washing is what's going to help.
Unless those heavy-duty masks, those serious, if you got one of those, maybe.
Good luck with that.
Good luck with that. Dr. Max Gomez, great information. Thank you so much.
You bet.